I'm Dominica. I've been diagnosed with depression and I'm being seen with So Cal Psychiatric Care.
How was your depression prior to TMS?
Before TMS, my depression was very severe, but I've had it for so long I didn't realize how severe it was. I did feel trapped. I had no energy to do anything. I constantly fell into pits of depression, and I took medications and everything, but it still felt like it was my norm, which wasn't good.
My depression prior to TMS was definitely debilitating. I found myself with pretty much zero motivation to do anything. A lot of my weekends when I wasn't at work would consist of being in bed. I was pretty much bedridden, and I was quite miserable. Yeah.
Hello, I'm Sanjoy Sathpathy, board-certified psychiatrist and founder of So Cal Psychiatric Care, or SCPC. We at So Cal Psychiatric Care offer psychiatric services to various mental health conditions such as autism, attention deficit hyperactive disorder, anxiety disorder, bipolar disorder, psychosis, as well as hard-to-treat depression or treatment-resistant depression. We use medication management, psychotherapeutic intervention, as well as Transcranial Magnetic Stimulation, or TMS. Is depression a disease? Yes, depression is real. Depression can be hard to recognize considering it's a subjective feeling of mind which has difficulty in sociocultural acceptance. Beyond the feeling of sadness, though experts have evolved some other symptoms of depression such as lack of motivation, sleep and appetite issues, feelings of tiredness and confusion, as well as low self-esteem. People often ask, what is TMS? TMS, or Transcranial Magnetic Stimulation, is a new and innovative treatment for depression. It is fully funded by health insurances and has minimal side effect. It is a definitive treatment for depression, and its efficacy as a treatment modality for depression is well known in the field of psychiatry and surpasses the efficacy of medication treatment. If you or a loved one suffer from depression, call us to set up an appointment for a free consultation to talk about TMS as a mode of treatment for depression.
How has your experience been with TMS?
Awesome. Really awesome. I usually come in, headphones, listen to my podcast, and when I tell my coworkers, I'm like, I'm gonna go for my Zappin nap, so it was great.
My experience with TMS has been a good experience. Interesting. When I first started TMS, I noticed instantly that I slept better. The first night that I got it, I had probably the best sleep I've had in a really long time. So that's probably the biggest thing I noticed in the beginning. And I've noticed waves of improvement through the treatment. And slowly but surely, I feel as if a lot of the weight of my depression has lifted. With TMS, medication, therapy, I'm definitely not where I was before. I am a lot more functioning of a person. I wouldn't even necessarily consider myself having severe depression as I did before at this point. I feel a lot lighter.
Can you tell us how you're feeling now?
I'm feeling grateful and free.
How has your experience been with us?
Wonderful. Really wonderful. You guys are so welcoming and so nice, and I never dread coming here. It's always hi.
What do you want to say to people looking for TMS treatment?
If you've already tried everything else, you only have everything to gain from trying TMS. It was my personal best choice, and I'm so thankful I made the choice to get TMS done, because now I honestly do feel like I am happy, and I'm not pretending to be happy. I'm not thinking my medication's working. I genuinely feel like I can be a good mom now and be at my best capacity as a person. And if anybody wants to have TMS done, there's a lot of science behind it. There's a lot of evidence behind it, and I did my own research, and I'm just so thankful I did it.